Jessica.
This is great to talk about, important to talk about, I should say, because new national data shows deadly drownings are increasing. So we want to show our viewers some of the numbers recently released by the U.S. Consumer Product Safety Commission. And just look at this here. In 2019, 354 children drowned. In 2020, the number dropped slightly, but in 2021, it surged to 380 deaths. In most cases, the victims were under the age of 5. So, what is the first thing an adult should do if they find a child or anyone underwater?
Right, the first thing, take a deep breath, try to get the child out of the water. That's the most important thing. If the child is unresponsive, if you're really worried, 911, of course, to try to get help. And then you have to ABCs, assess the airway. Are they breathing? Do they have a pulse? And if they don't, we have to begin CPR.
Okay, and according to the CPSC, drowning is the leading cause of death among children ages 1 to 4 years old. Is CPR different, though, for infants versus young children?
It's a little different. Here's the key. Remember, fast and hard, okay? The first thing, of course, you want to check, are they breathing? Do they have a pulse? If they're not breathing, if they don't have a pulse, you have to start. The differences is basically, for both adults and children, it's 100 to 120 chest compressions a minute. Think how fast it is. That's 1.5 to 2 chest compressions a second. So really fast, okay? With infants, right, younger than 1, it's really 2 fingers right between the breastbone. Okay? With older children, it's usually the heel of the hand, just like an adult, right in between the center, and you're pressing down. It's typically 30 breaths for 30 chest compressions for every 2 breaths, okay? But here's what I want to say. Some people are afraid to breathe. It can be scary, it can be intimidating, okay? Keep the chest compressions going as you're waiting for 911 to come. And here's the other thing. You can always use a shirt or something to put over the mouth that's like breathable, and you can breathe through there. So that's, it's scary, but inaction can kill, so you want to do something.
Yes, absolutely. Okay, let's talk prevention, because I think this is important too. What does anyone with the pool need to know?
Listen, this is really important. Swim lessons can save lives. There's about 45 million adults in the United States that don't know how to swim. So that's the key. And remember, vigilance is important. I remember when my boy was about 2 years old, I was playing with him in the water. I took my eyes off him for a few seconds, and he was like underwater for a few seconds. And wow, you never think about that. So you can't be too vigilant, but we're human, you've got to be careful. Always you want to have that eye on the child.
Swim lessons, and you can start them young too, very young.
You can.
Okay, Dr. Ellerin, we always appreciate your advice. This is very important to talk about, so I'm glad that we are.
Good to see you, Jessica.
CPR lessons, also want to stress, important to take if you can. Shane, over to you.
All right.